Every program in health and public service needs to train professionals that can hit the ground running. So the way that we do that, a number of different ways. We do laboratory education, we do simulation training, and we do clinical or internship placement. Simulation training, we actually have high fidelity mannequins that can simulate any health emergency that they may have. It really helps the students to get that hands-on training that they're going to need to be successful in their profession. As interim dean of the College of Health and Public Service, I oversee all of our health and public service related programs, our faculty, and students. It is a big college, from police to PA to everything in between, so it takes a team to actually help run the college. We rely on faculty to be specialists in their field and to let us know what the equipment needs are. We look for what's the latest and greatest in that industry. We can't be training students on equipment that's now outdated and not used in industry. So we make sure that we meet the industry standards so that our students are trained and ready to go on into their profession. I went to college as a journalism major, and my favorite class, my first semester, was nutrition. I had never taken a nutrition class, and I found that it was the nutrition homework that I wanted to do when I got home. On a whim, I was flipping through a catalog of classes and found a women's health class and thought, well, that could be interesting just personally. I took the class and fell in love with the profession of public health. I didn't know it was a profession, I didn't know it was a major, but found out through that women's health class that there was a whole field that really took that nutrition part that I loved and had the population level applicability. I didn't care how vitamin A broke down in the body. I cared how to get people to eat more nutritious food to have vitamin A. And so that was really about finding the right fit for me and my major. In an administrative role, it is very different from being in the classroom. The decisions that we make, the programs that we start, the facilities that we create, the students may not ever know that we worked really hard on those projects. And so it's more behind the scenes, but it also has the ability to help a larger number of students. So if I look at something like the Lehigh building, where it was a really tough construction project, writing grants to get the funding for it, there were times when I didn't think it was actually going to happen. And yet now that we have beautiful facilities, we have a lot of students who are getting an education here who have no idea what it took to actually make this happen. So it's very fulfilling to affect change on that level. One of the pieces of advice that I often give students is to not see the roadblock as the end of the road, to look at what else might be past it. When I've welcomed freshman students, I often tell them to come up with a backup plan, because a lot of us find that that backup plan ends up being what we love and what we do. So I encourage them to not get so stuck in one major that they can't see that there's lots of opportunities here for them.